Now I'd like to pass you over to Kristen Young. Kristen has, as I said, the BRCA2 gene mutation. Her whole family's been impacted by this discovery, and she's very passionate about increasing awareness so that other women get the option that she did not indeed herself have. I'd like to pass you over to Kristen now.
Hi, I'm Kristen. I have recurrent ovarian cancer, and I also have the BRCA2 genetic fault. So I discovered I had ovarian cancer back in 2009, and the high-grade serous, and was treated in the normal way with surgery and chemotherapy, and that went along in a pretty straightforward way. The picture of my dad there, my dad had died of prostate cancer about 6 years before I was diagnosed. And I think that was enough, and a couple of other things that made my oncologist ask the question is there possibly a family history here? The other thing that I think influenced her to ask that question was the fact that at 47 at diagnosis, and that's relatively a young age to be diagnosed with advanced ovarian cancer of that type. So I think that was what was in her mind. So I was very keen to have the testing. And so I organised that pretty much as soon as possible that I could have it. I didn't go to a family cancer service, but I was referred to a geneticist who worked closely with the treatment team, not as an actual service, but he did the same thing basically. And I went there with a couple of family members and went through the provision of the family history and then the testing itself, so which was done at the public hospital. And in those days, the wait to get the test results back for the first person who's tested in the family, it took me 4 months to get the results. That was okay because I was still progressing through chemotherapy. I had plenty on my mind. So now to talk a bit about the family. The picture is me with my chemo curls. I normally have straight hair, as you can see, and that's my mother and my brother and my sister. As I said, my father had died of prostate cancer. His twin sister had also died young of a bilateral breast cancer, and I say young, under 60. And their mother also had some form of breast cancer, but was not too sure what it was. But that's as big as the family was. That was a very, very small family. And of course, there's no ovarian cancer in that story. But true enough, when the testing came back, it did become, I was BRCA2, and suspected it had come from the father's line. As my mum, who's in that picture, is still living, and still is living to this day. Hi, Mum. We just to be sure, she, after counselling from the genetic advisor, agreed to have testing herself, just so that we could rule it out that it came from her side. If it came from her side, then there were issues about she has a much larger group of relatives on her side that might be affected. But knowing that it came from Dad's side, small family, only a small number of people affected. So that does make it a little bit easier to manage. It's a picture of me during my first chemo with the usual hair loss and all that sort of thing. But I've done my reading during my chemo, and I had heard that there are advantages in being BRCA2 positive, and one is that you tend to be more treatment responsive to normal chemotherapy agents. This is what I was told, like not necessarily a whole lot more, but a little bit more. And perhaps for that reason, they tended to have, people with BRCA2 tended to have slightly better survival curves. So that was the good side. But then there was the whole thing is, what do we do with the rest of the family? And this is where, cancer in one family member definitely affects the rest of the family. But when the genetic faults are involved, it affects the family in a whole new bunch of ways. The first thing is I don't have children, so that was one of the biggest issues. Wasn't an issue for me, and that is, have I passed anything on to my children? No children, so not an issue. Then there was the question of whether my siblings wanted to be tested. Again, that's me on a road trip after my first chemo, getting back out there and trying to enjoy myself. So they had to decide what they wanted to do. So my brother and my sister both got tested, and I have their permission to say that they both tested positive as well. So we think we're a bit of a particularly lucky but unlucky family to have 3 out of 3 who all carry the BRCA2 mutation. So I'll just talk a bit more about my experience, and then I'll talk about the family, the effect on the family. It's a funny thing when you have this, because part of you has got relief because, oh, you know that, oh, maybe there's going to be more treatment options, but sometimes the sense is a little bit like, oh, am I somehow to blame, or do I feel responsible in some completely illogical way for causing health problems to the rest of my family? I know that's not true. Obviously, one hasn't done that, but it's funny how that goes into your mind, that you worry that somehow you're responsible. And I imagine that made it feel a lot worse for people who have their own children. So I had a long remission after my first treatment, and I did really well for about 4.5 years. And then in 2014, I had my first relapse and went back into treatment. So the very first thing I had been talking about it all along through my remission is, when you relapse, we're going to look at a PARP inhibitor trial. As you probably heard mentioned earlier in the presentation, PARP inhibitors are known to be particularly effective with the BRCA, and I was desperate to get on a PARP trial. I went to considerable lengths and effort to make sure I was able to meet the criteria. To give you an example, you have to have a certain hemoglobin level to be accepted onto the trial. So I was having trouble getting that. My hemoglobin was a bit low. So leading up to it, I was eating huge big red steaks and dehydrating myself so that the hemoglobin levels would come up in the blood, because I really wanted to get on that trial. So I did, and I've been on that trial now for the last 2 years. So this is all the upside of BRCA. And the downside at a personal level, because most of the downside is for the family, but the downside personally is the risk of breast cancer. For a lot of people, this creates a very high level of anxiety. They've already had to deal with ovarian cancer with the very dramatic surgeries that go with that, and now they might also have to deal with breast cancer. So this generates a very wide range of different responses that people have to this. My response to this is just to participate in a high-risk monitoring program at my hospital, where I'm called in every 6 or 12 months, and there's a predetermined schedule of testing and examinations, including breast MRI. So as far as I'm concerned, they're looking after that. The other issue is about some people consider having a preventative mastectomy, but there's a whole formula that one needs to look into about whether that's worth it for a particular individual, and your age group is a factor as well. But that's a technical thing you might want to talk to your doctor about. There's me and Mum at a fundraising event for people with metastatic cancer. So it's a funny feeling being a gene mutation. You kind of feel special in a way, but you also feel like you're a marked woman. You've got this fault, and and you have the thought of, is the axe waiting to fall? But the advantage is that if it does start to fall, you probably do better on treatment. Let me talk about the family a bit more, because it's when you're the one with the cancer, it's pretty obvious what you're going to have to do, all this stuff to try and save your own life. The family members are faced with a different bunch of decisions. They're faced with decisions around preventative surgeries or preventative medications, which is an option, but they don't actually have any ill health yet. So they have to make decisions that will affect their health by these preventative actions without actually having cancer. So perhaps giving themselves early menopause, blah, blah, and that type of thing. And the privacy is one, I think, of the most difficult issues. People worry about if it gets out or becomes known that I have the gene fault, might I have trouble getting life insurance, for example, what's the implication for my family and their financial security? Is it something, if it gets out that one of my family members is BRCA, then everyone might think that I am too. So they might ask invasive questions or my privacy might be breached. So it's quite a lot of a challenge to work out if you're a BRCA carrier, should you even talk about it publicly, because other members of your family will be in the public eye as a result. So children, that's the difficult one. And it's things like the age of children in families where adoption is an issue or assisted fertility has been an issue, and where genetic lines are not clear or any of those things have gone on, it makes it doubly tricky as well. If there's a child that has not been brought up in your family but may have your genetic material, how does that child get access to that information? So in terms of the message, of course, there's lots of myths, and I'm on my way, almost sort of finish what I'm going to say now. A lot of fear and a lot of myths, and I understand that there's something to be fearful about, but that the knowledge and support is much better there. If back when my dad had prostate cancer, they were able to identify that there was a family history, which was difficult given the family was small and genetic issues were not so evident back in those days, they might have tested us and I might not have had ovarian cancer. So, but, you can't regret what you can't change, but yes, it would have been nice and I wouldn't have had to go through all of this. So there is an advantage in asking the question. But when you're asking the question about yourself, I found that it helped to ask every relevant family member how they felt about it before I took the next sort of action. So yes, it's not just the BRCA2 and 1, not just breast cancer, it's ovarian cancer. Small families, you've got to watch out. The families are too small to get an obvious family history. Watch out for the father's lines. Watch out for how you will feel if you get the test results back and they're ambiguous, which can often happen. And if you've decided that you want to know, once you know, you can't unknow it. So you can't take that knowledge away. So you have to really take that counselling from the Family Cancer Services to decide how it would help you if you did know. Would it change what you did to know? Do you really want to know for sure at the age of 20, for example, if you know that the best time to have the preventative surgery is when you're 40? These are the things that are not straightforward and you can talk to the Family Cancer Service about. So that's my story in a nutshell, and that's what I feel as someone who's BRCA2 and likes to dress up in teal and go to things, as you can see. That's what I think.
Thanks very much, Kristen. Again, I'd just like to invite participants to ask any questions that you might have with Kristen. Kristen, already there's some comments rather than questions. Annette, I'm Kristen's mate, and I'm sorry to report that we missed a photo of the 12 apostles on that road trip. They were too busy talking. And what a legend you are, Kristen. You're a real fighter.
Yes, and that's my friend Annette's shoes I'm wearing. No, I think you've got to keep on the move, and I think trying to do as many normal things as possible, even when you're unwell, and try and live a normal life if you can, even though it's much reduced by your illness. Yeah.
Kristen of Jeanette T has just said thanks. That was a fantastic presentation.
Thanks, Jeanette.
I wonder. I've got a question for you, Kristen. I'm just wondering how you found the counselling. You did the counselling yourself, and how you found that.
I did the which myself.
The counselling, the genetic counselling, when you went to the testing.
He was actually it wasn't a family cancer service, as I said, but it was a geneticist. He was a scientist that works closely at the hospital. So he's very, very knowledgeable. And, well, he just had the technical knowledge, but also what he was able to do is explain to other members of the family what their risks were, because that's something that I can't do, and it's not even my place to do it. And as I said, one of the hardest things about being BRCA positive and all of that is knowing that the other people around you might have it too and have their own issues. So if you have an expert such as the genetic counsellor who can reassure and explain to the family members, it takes the pressure off the individual. Because I've said you get this completely irrational sense of responsibility that somehow you've caused their problems which you haven't. So having an expert and someone who knows how to explain it takes a lot of that pressure off. And I would always just say to people, go to a family cancer service. And certainly a lot of the members of our extended family have done just that.
Thank you, fabulous. There's a couple other comments. Virginia S. Virginia is your sister. And she just mentioned that because you've got the cancer, she's been able to avoid the cancer.
Yeah, so everything that the person with cancer does has an impact one way, or good or bad, on the family members when it comes to the genetic things. So if you decide not to be tested, that has one type of impact. If you decide to be tested, that has another impact, which can be good in some ways and bad in others. So my position all along is to do it all in consultation. And when families are in conflict or have separated by distance or some other reason, that would be a lot more challenging.
Indeed. Virginia goes on to say that one of her daughters was tested at the age of 22 because she wanted to decide whether to start her family, and she found that she was negative, which was really fortunate, and now she doesn't have to rush to have a family.
Yeah, so whereas you might say, oh, do we really want to test? Does a young person really want to test because, what if they found out they were, maybe they'll feel very, very anxious and want to have dramatic preventative surgery. At the same time, finding out allows a young woman like that to make that sort of decision. But this is why you need the family counselling, why the people trained in genetic counselling to look at those fors and against, because it's absolutely not a black and white decision.
Thanks, Kristen. Do we have any further questions for Kristen? Is there anything further, Kristen, you would like to share?
No, if any questions come in as we're winding up, I'm happy to answer.
Alison, do we still have you online?
We do, yes. Hello.
Hello there. I was wondering if you could just pass on that message that you passed on to me about Linda.
Yes, I've been contacting Linda Malishkin about possible studies for women who are BRCA wild type. So that was in reference to Jeanette's question. She said there are some immunotherapies. There are some anti-PD-1, which is immunotherapy. You'll have there's been quite a lot of news about it in the press in regard to melanoma. And I believe there are some trials open. So I would advise anybody who needs a trial in particular, I think it was Jeanette who contacted, to contact Linda Malishkin, and she's at thepetermac.org. You may be in Sydney, but she would be able to let you know whether the trial is open in Sydney and who you should contact about that.
That's great. Thanks so much for following that up. Yes, go on.
I was going to say, I think I could see Jeanette typing.
Jeanette's got as far as saying that she was at the North Shore Hospital and she was supposed to go on a trial.
Okay.
And we'll just wait for the lapse in the typing. Yes. Jeanette said she didn't actually get on the trial, but she was accepted.
But then the trial closed before you got recruited, was it? Well, I would contact Linda here and have a word with her about possible trials, and see what options you have. So that's Linda Malishkin here at the New Victorian Cancer Centre. So the telephone number will be different. I'd advise you to have a quick look on the website.
I can say something else about the trials, is that I feel, even though it was a close run thing, that I would actually get on that trial. I was down to trying to meet the eligibility criteria in the week prior to it being scheduled to close. I'm so glad and I'm so lucky that I'm on it. And I know I got on it because of the BRCA, but it's a weird thing, is that you feel, I suppose we're getting off genetics and onto trials, but when you're on a trial, you feel like, you're really lucky, and the other people who just have to wait and see, like most people do, you sort of feel a bit guilty to be that lucky. So, yeah, I don't know why. It sounds funny to say that I'm lucky that I've got a gene mutation that gives me cancer, but I really see it that way. And I was very, very pleased to have it. Not so pleased for the family, but now that I've actually got ovarian cancer myself, it's the way to have ovarian cancer with BRCA.
Can I just give Jeanette the number? So the number for the new Peter McCallum is 03, that's Victoria, 8559 5000. So that's 03 8559 5000. Yes, you've spelt her name. It's an I instead of an E at the beginning, and the email address is at petermac, petermac.org. So her name is spelled Mile, MILESHKEN. That's right. You have the telephone number correct.
Excellent. Wonderful.
Thank you.
Thank you. And one final call out for questions before we wind up the webinar. Could I ask if there's anything further that Alison or Kristen would like to share before we close it up?
Well, I just noticed that my sister Virginia has commented that trials give you hope as well as treatment.
Yes.
And yeah, the feeling that I have that I'm I'm a special BRCA person, and that something always seems to be coming up for us BRCA people, is that oh, this is going to work better, or we've got a new thing being developed for you guys. And jokingly, I always say it always pays to be more interesting to your doctors. And, though I don't mean to say that doctors don't give everybody equal care, because of course they do, but when it comes to new research and new ideas, genetics are currently where it's all at, and that just puts me in a really good position to benefit from new ideas, and hopefully that will trickle out to the family as well.
Thank you. And sorry I missed that, Virginia. You're right. Trials do give hope, and I think hope is what's really important for this cohort. Thank you very much. So this brings us to the end of the webinar. If we don't have any further questions, I'd really like to thank Associate Professor Alison Traynor and Kristen Young for being our guest presenters. We really do value and appreciate the information and the time that you've invested in us today. So for our participants, the webinar will be recorded and it will be available on our website early next week, within a week. Thank you everybody who's attended today's webinar. Your feedback is very important to how we develop and deliver programs. If we please take a moment to fill in our online survey, you'll be directed to that as soon as I finish talking. And one final thing I'd like to say is that Ovarian Cancer Australia has launched our new and improved online community forum. OCA Connect is a place where you can join with other women with ovarian cancer to seek support, advice and information. You can find information on that on our website. Okay, once again, thank you to our presenters and we'll see you at the next webinar.
Thank you. Pleasure.
Thank you.
Thank you.
Thanks.